Common questions with answers about AMH testing. The Anti-Mullerian hormone test is a simple blood test that helps you understand your reproductive status no matter your age or future family plans. In an effort to raise the awareness of female fertility around the world, we compiled a list of frequently asked questions to help you understand the benefits of doing an AMH test. What is the Anti-Mullerian hormone test? It is a screening test that helps you determine your reproductive potential by measuring the level of Anti-Mullerian hormone, AMH, in the blood. AMH is a female sex hormone secreted by the granulosa cells of developing ovarian follicles, which are fluid-filled sacs where eggs grow. This is a reliable indicator of a woman's ovarian reserve. What is ovarian reserve? The ovarian reserve, also known as egg count, is an estimate of the number of remaining eggs in a woman's ovaries. Although the exact number of eggs cannot be determined using an AMH blood test, you can get insights into the number of ovarian eggs at any stage of your fertility journey. How does age affect AMH? As women get older, the quantity and quality of their ovarian egg reserve gradually declines. In addition to age, each woman is born with a certain amount of eggs and has individual factors that determine how fast her ovarian reserve will be depleted. What are the levels of fertility among women of reproductive age? About 25% of women have a high egg reserve and subsequently a longer reproductive lifespan. When tested, they demonstrate higher AMH levels. Around 50% of women have a normal egg reserve and a normal amount of AMH in the blood. The remaining 25% of women have a low ovarian reserve and hence lower AMH levels. This group of women is at risk of running out of eggs earlier and should take precautions to mitigate any future fertility problems. This can come in the form of starting a family, keeping track of your hormone levels over time, or freezing your eggs. Can AMH levels increase naturally? There is no food or supplement that can increase your AMH level. However, there are still ways you can improve your fertility and therefore increase your chances of conception. Why should I get my AMH checked? AMH can be used to gain valuable information about female fertility and reproductive health, such as measuring ovarian reserve, predicting the chance of success with fertility treatments like intrauterine insemination or in vitro fertilization, diagnosing diminished ovarian reserve or premature ovarian insufficiency, investigating the causes of amenorrhea, which are absent periods in adolescent girls, diagnosing polycystic ovary syndrome, monitoring women with certain types of ovarian cancer, predicting the onset of menopause. Does AMH answer all my fertility-related questions? Using an AMH test, you can accurately estimate your ovarian reserve. However, the number of ovarian follicles is only one aspect of your fertility, as there may be other factors involved in determining the likelihood of falling pregnant. Can I diagnose the cause of my infertility using the AMH test? The test can tell if you have a low ovarian reserve, which is one of the main causes of infertility. Remember, there may be other factors such as lifestyle, medical conditions, anatomical issues, or hormone imbalances that can contribute to infertility. Hence, the AMH test alone can't be used to diagnose the cause of infertility. For this reason, we advise you to see a doctor or fertility specialist to schedule a full assessment. Does the AMH test egg quality? AMH alone cannot determine if your eggs are healthy. However, having a high egg count increases your chances of having good quality eggs. The test can tell if your egg reserve is normal for your age, but it doesn't guarantee conception, nor it predicts the probability of falling pregnant. Your doctor may order additional screening and diagnostic tests to get a more precise picture of your fertility. I am 25 and don't plan to have kids anytime soon. Should I consider taking the test? Yes, though the AMH is not a crystal ball, it can help you predict your future egg reserve. This knowledge can help plan your studies and career before starting a family. How is the AMH test performed? The AMH blood test can be done either at a local laboratory or at home. In-lab testing involves drawing blood from the vein. Home tests, on the other hand, use lancets, a small finger prick test, to collect blood from the finger. Once collected, the blood sample is sent for lab analysis. Can the AMH test be done during periods? Yes, the AMH test can be done on any day of your menstrual cycle because the anti-Mullerian hormone remains unaffected by the cyclic changes. Does the AMH test require fasting? No special preparation is needed before the test. How much does the AMH test cost? In-lab AMH tests can cost around £100 and more. Home-based alternatives come at a much lower price. The at-home AMH test kit by Fertility Connected is available for £69. Where to get an AMH test? You can order the AMH home test kit directly on the Fertility Connected platform. Alternatively, you can choose to order the test online and do it at a local partner laboratory. Is the quality of at-home tests different than in-lab tests? No, both tests use the same standards and technology to perform the blood analysis. Scientific studies and biomarker validation confirm there is no difference in the accuracy of these two methods. The only difference is the method of collecting blood. Is the AMH test covered by insurance? It depends on your insurance plan. If you have fertility coverage, then the AMH test will be covered as part of your infertility evaluation. Speak with your insurer to find out more about what you'll be charged. How is the test kit box delivered? Your test kit will be shipped in an opaque envelope labeled with your name and address. For privacy purposes, there won't be any logo or text indicating there is a blood test within the envelope. You'll find instructions on how to perform the test in the kit box. For more questions on shipping and delivery of orders, please contact us on support@fertilityconnected.com. How long does it take to get the result? Once you collect a small sample of blood on the dried blood card, DBS. Place the card inside the brown envelope and arrange an express pickup. The sample will be delivered to our partner laboratory in the UK. The results will be available through the Fertility Connected website or app in 3 to 7 days. Low-level AMH indicates a low ovarian reserve, which is quite normal as women age. Lower than normal AMH levels before age 40, however, may indicate an underlying medical condition. An AMH level, usually over 21.42 picomole per liter, could be an indicator of polycystic ovary syndrome. It could also indicate your risk of ovarian hyperstimulation syndrome in IVF cycles. Talk to a doctor or fertility specialist for more correct interpretation of your results. How can I compare AMH levels of different labs? AMH can be measured using many different test methods. The levels of AMH can vary depending on which test was used by the laboratory. This is due to a difference in sensitivity and calibration of test methods. Therefore, the results of two different test methods should not be compared directly. Use the reference range recommended by your lab to interpret the result. Does AMH fluctuate? Although there may be insignificant fluctuation, your AMH is relatively stable throughout the menstrual cycle. Repeated testing, however, can significantly improve the accuracy of the results. Can AMH levels increase after pregnancy? Pregnancy may temporarily decrease your AMH levels. The magnitude to which this change will happen depends on your age. The decline of AMH in women aged 35 and beyond is more significant than in women under 35. However, once the baby is born, AMH is expected to go back to its normal levels, usually on the 4th day postpartum. What is the expected difference in the test results of the same person? On average, the difference between your first and second AMH test is expected to be around 30%. For instance, a woman with an AMH level of 10 picomole per liter is expected to have AMH in the range between 7 to 13 picomole per liter if the test is repeated within a few months. This is dependent on the current state and number of the growing follicles in your ovaries, as well as the analytical variation of the test. What AMH level is considered normal? A normal AMH level for a fertile woman is over 7.14 picomole per liter. The low normal range is between 5 and 6.5 picomole per liter. What AMH level indicates menopause? AMH below 0.2 picomole per liter and FSH levels above 30 milli-international units per milliliter are used to indicate menopause. The same reference values can help detect early menopause before age 40. Does high AMH indicate PCOS? The concentration of serum AMH above 21.42 picomole per liter is considered high and is often used as an indication of polycystic ovary syndrome (PCOS). Further testing may be required to establish a correct diagnosis. When AMH is too low for IVF. AMH below 2 picomole per liter is associated with extremely low pregnancy rates. Some IVF centers may deny treatment to women with such low levels of AMH. What is the reason for low AMH? With increasing age, the eggs in your ovaries decrease, and so does the anti-Mullerian hormone. Lower levels of AMH can also indicate conditions such as primary ovarian insufficiency or early menopause in women under age 40. What AMH level is good for IVF? A good AMH level for IVF is anything within the normal range 5 to 21.42 picomole per liter for a woman under 38. I'm comfortable with my result, so what should I do next? If you're happy with your result, we recommend repeating the test within 12 to 24 months to make sure your ovarian reserve is tracking well. This will help you get insights into your fertility over time so you can plan your future. Start your fertility journey today. We hope this video helped you to learn more about the anti-Mullerian hormone and the available options to test it. If you want to improve your reproductive health, order the at-home AMH test now and feel empowered on your fertility journey.